Hey everybody, my name is Taylor. I decided to go with racially biased medical devices, put it into a couple categories. I'll start with optical and sensory-based devices, mainly devices that rely on light to measure physiological markers. Um, these are often a lot less accurate on individuals with dark skin tones because of the higher melanin levels, which can interfere with light absorption and reflectance. Uh, First one I'll go with is the thermometers. So, like the forehead thermometers. Found a study that stated that is 26% less likely to detect a fever in black patients compared to an oral thermometer. This can lead to misdiagnosis and delayed antibiotic treatment. Pulse oximeter, which is probably the most commonly known one, this very often overestimates blood oxygen levels in black patients, potentially masking dangerously low oxygen, which could be called occult hypoxemia. This bias was particularly lethal during COVID, which led to delayed treatment for black and Hispanic patients. One last one. Wearable fitness trackers, not necessarily a medical device, but it's such a common thing that people have now, and it's used for breathing, heart rate, things like that. So I figured I'd put it in because this is also under kind of this category. Fitbits specifically, they use PPG sensors, which is often a green light. These struggle to accurately track heart rates in people with darker skin. The green light is typically absorbed by that melanin. Respiratory tools. This, in general, bias in these tools often stems from historical race correction factors embedded in the software itself. The one that I wanted to focus on is spirometers, which is kind of a breathing tool developed in the 1840s, still used today. There's an electronic one and like a manual one. We'll deal with the electronic one. So this measures how much air an individual breathes in and out and how fast. However, there's a correction factor based on outdated assumptions that black and Asian people have lower natural lung capacity. This can lead to underdiagnosis of like COPD, which is like a pulmonary disease. It's very treatable, but uncurable, and lower likelihood to receive like lung transplants, and that's a big one. Although there's many studies that have found on average black individuals have a lower lung volume than white people. However, that is an average. Race-based lung function algorithms, which are equations that basically would help doctors interpret things a little faster based on like age, sex, height adjustments. Assume that lower basically assume that lower lung volumes are expected and hence normal, quote unquote, in black people. These algorithms are also used in like surveillance programs to detect development of lung disease and potentially hazardous workplaces. So it has multiple applications. Individuals that have it already have this lung disease. These algorithms are also used as a guide to select medical therapies, surgical interventions, decisions on lung transplant, things like that. So, for an example, two otherwise identical patients may be treated differently based on the color of their skin. A white patient might receive treatments not offered to a black patient, might be referred for a lung transplant earlier in their disease course, could be assigned like higher priority, things like that. I found another article in the New England Journal of Medicine published in 2024 showed that more Black patients would have qualified for different disease classifications, occupational eligibility. So things like being an astronaut, being a pilot, being in the Air Force, things like that. Disability disability payments, sorry, misspoke. Those in the military, so veteran payments, things like that. This is all inclusive and a very outdated system that we are trying to update, and more things are being studied and published. So hopefully this helps.